Summary. More than 1 in 3 adults in the US has high blood pressure, or hypertension. Many of those people don't know they have it, because there are usually no warning signs. This can be dangerous, because high blood pressure can lead to life-threatening conditions like heart attack or stroke. The good news is that you can often prevent or treat high blood pressure. Early diagnosis and heart-healthy lifestyle changes can keep high blood pressure from seriously damaging your health. What is blood pressure? Blood pressure is the force of your blood pushing against the walls of your arteries. Each time your heart beats, it pumps blood into the arteries. Your blood pressure is highest when your heart beats, pumping the blood. This is called systolic pressure. When your heart is at rest, between beats, your blood pressure falls. This is called diastolic pressure. Your blood pressure reading uses these two numbers. Usually the systolic number comes before or above the diastolic number. For example, 120/80ths means a systolic of 120 and a diastolic of 80. How is high blood pressure diagnosed? High blood pressure usually has no symptoms. So the only way to find out if you have it is to get regular blood pressure checks from your healthcare provider. Your provider will use a gauge, a stethoscope or electronic sensor, and a blood pressure cuff. He or she will take 2 or more readings at separate appointments before making a diagnosis. You have high blood pressure if your readings show that your systolic is 140 or higher OR. Your diastolic is 90 or higher. Some providers may consider you to have high blood pressure if you have other heart risk factors and your systolic is between 130 and 139 OR. Your diastolic is between 80 and 89. Blood pressure readings above 180/120ths are dangerously high and require immediate medical attention. For children and teens, the healthcare provider compares the blood pressure reading to what is normal for other kids who are the same age, height, and gender. People with diabetes or chronic kidney disease should keep their blood pressure below 130/80ths. Who is at risk for high blood pressure? Anyone can develop high blood pressure, but there are certain factors that can increase your risk. Age. Blood pressure tends to rise with age. Race, ethnicity. High blood pressure is more common in African American adults. Weight. People who are overweight or have obesity are more likely to develop high blood pressure. Gender. Before age 55, men are more likely than women to develop high blood pressure. After age 55, women are more likely than men to develop it. Lifestyle. Certain lifestyle habits can raise your risk for high blood pressure, such as eating too much sodium, salt, or not enough potassium, lack of exercise, drinking too much alcohol, and smoking. Family history. A family history of high blood pressure raises the risk of developing high blood pressure. How can I prevent high blood pressure? You can help prevent high blood pressure by having a healthy lifestyle. This means eating a healthy diet. To help manage your blood pressure, you should limit the amount of sodium, salt, that you eat, and increase the amount of potassium in your diet. It is also important to eat foods that are lower in fat, as well as plenty of fruits, vegetables, and whole grains. The DASH eating plan is an example of an eating plan that can help you to lower your blood pressure. Getting regular exercise. Exercise can help you maintain a healthy weight and lower your blood pressure. You should try to get moderate intensity aerobic exercise at least 2.5 hours per week, or vigorous intensity aerobic exercise for 1 hour and 15 minutes per week. Aerobic exercise, such as brisk walking, is any exercise in which your heart beats harder and you use more oxygen than usual. Being at a healthy weight. Being overweight or having obesity increases your risk for high blood pressure. Maintaining a healthy weight can help you control high blood pressure and reduce your risk for other health problems. Limiting alcohol. Drinking too much alcohol can raise your blood pressure. It also adds extra calories, which may cause weight gain. Men should have no more than 2 drinks per day, and women only 1. Not smoking. Cigarette smoking raises your blood pressure and puts you at higher risk for heart attack and stroke. If you do not smoke, do not start. If you do smoke, Talk to your healthcare provider for help in finding the best way for you to quit. Managing stress. Learning how to relax and manage stress can improve your emotional and physical health and lower high blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and meditating.